Evening. Welcome back to the channel.
Today is Monday, May 25, 2026, and we are breaking down a massive wave of medical breakthroughs that are shifting the healthcare landscape right now. In this video, we are unpacking 5 major updates, a new discovery from the National Institutes of Health, NIH, on how weight loss drugs rewire brain cells, the Food and Drug Administration, FDA, greenlighting a first-of-its-kind targeted breast cancer therapy, an AI model that uncovers hidden, drug-resistant superbugs, a World Health Organization alert, and a stunning clinical trial proving food combinations are changing how your body absorbs nutrition.
If you want to stay ahead of the curve on human health, make sure to hit that subscribe button and turn on notifications. Let's dive straight into today's top medical bulletin. To line up: 1. Brain chemistry of weight loss. 2. Historic FDA cancer approvals. 3. AI versus superbugs. 4. Who cruise ship alert. 5. The smoothie nutrition myth. Segment 1. How weight loss drugs alter the brain. Our top story comes from a brand new study published in Nature Metabolism by researchers at the National Institutes of Health. We already know blockbuster GLP-1 drugs drive massive weight loss, but until today, the exact cellular mechanism in the brain was a bit of a black box. Researchers have officially mapped out how semaglutide influences brain cell activity. It works through specific CAMP-dependent pathways inside GLP-1 are expressing neurons in the hindbrain. Essentially, the drug doesn't just block hunger signals, it fundamentally alters the firing frequency of neural circuits that control long-term energy balance and metabolic drive. But that's not all for metabolic news. A secondary AI analysis of over 400,000 public health discussions on Reddit just uncovered several previously undocumented side effects of popular GLP-1 treatments, including unexpected menstrual irregularities, sudden chills, and severe hot flashes. This highlights how big data and AI are helping clinicians catch patient experiences that standard, short-term clinical trials might miss. Segment 2. Historic FDA cancer approvals.
Moving to oncology, the FDA has just handed down an incredibly significant approval for one of the most aggressive forms of oncology, triple-negative breast cancer, TNBC. The agency officially approved datopotamab deruxtecan, commercialized as Datraway. This marks the first-ever TROP2-directed antibody-drug conjugate authorized as a first-line treatment for adults with metastatic TNBC who cannot receive standard immunotherapy. In clinical trials, Datraway achieved what doctors have been chasing for decades: a statistically significant overall survival advantage over standard chemotherapy in this highly difficult-to-treat patient population. Additionally, the FDA granted accelerated approval to Hepcludex, bulevirtide mod, making it the first and only approved treatment option for adults battling chronic hepatitis delta virus, HDV. These structural rollouts are fundamentally expanding the arsenal doctors have against terminal and chronic diseases. Segment 3. AI language models expose superbugs. Antimicrobial resistance is one of the greatest threats to modern medicine, but artificial intelligence is turning the tide. Scientists have just debuted a cutting-edge genomic language model tool called ResLens. Standard medical databases can only scan for known, pre-recorded antibiotic resistance genes, RGs. However, ResLens works like an advanced grammar checker for DNA. By analyzing raw genomic sequences, especially long-read data, this AI can detect hidden antibiotic resistance genes that are completely missing from global reference databases. This means public health departments can now hunt down hidden superbugs before they ever cause an outbreak in hospitals, giving researchers a massive head start on synthesizing next-generation treatments.
Segment 4. Global Health Alert and Medical System Updates. Next up is an ongoing international safety notice from the World Health Organization, WHO. The agency is actively monitoring a deadly Andes virus, hantavirus, cluster that originated aboard the cruise ship MV Hondius. While the global population risk remains low, the case fatality rate among those infected on the ship reached a staggering 38%. Epidemiologists are currently debating the exact role of airborne transmission in this specific strain, making international contact tracing vital right now. Meanwhile, on the regulatory front, the European medical community is preparing for a massive shift as UDIM database registration becomes strictly mandatory for all new medical devices. This will drastically increase device tracking transparency across global medical supply lines. Cars, planes, and trains, heart disease. Starting at around 50 decibels, between the volume of a refrigerator humming and a friendly chat, traffic noise can raise your blood pressure and the likelihood of heart failure. For each 10 decibel increase, your odds of heart disease and stroke go up even more as scientists think it's tied to how your body reacts to stress. WebMD.
Cardiovascular diseases could be among the world's first medical conditions to be treated by changing a patient's genes if ongoing phase 3 trials succeed. Gene editing will offer a novel therapy for transthyretin amyloidosis, and treatments for hyperlipidemia may not be far behind.
WebMD. Brain fog. A lack of B12 may lead to depression, confusion, memory problems, and dementia.
It also can affect your balance.
B12 supplements are usually safe. For adults, doctors recommend 2.4 micrograms a day.
If you take more than what you need, your body passes the rest out through your pee.
Still, high doses could have some side effects, like dizziness, headache, anxiety, nausea, and vomiting. WebMD.
Segment 5, the smoothie nutrition myth and daily wellness.
Finally, let's talk about something right in your kitchen that changes how we think about daily nutrition. A surprising study published this week reveals that adding bananas to berry smoothies drastically reduces the body's absorption of healthy flavonols. Berries are packed with these heart-healthy antioxidants, but bananas contain high levels of an enzyme called polyphenol oxidase.
When blended together, this enzyme breaks down the flavonols, effectively destroying the nutritional benefits of the berries.
If you are looking to boost your cardiovascular health, scientists recommend swapping the banana for ingredients like yogurt or mango to keep those antioxidants intact.
Furthermore, another clinical trial dropped a bombshell regarding diet, showing that consuming 6 to 7 ounces of beef daily for a month resulted in zero worsening of blood sugar control or insulin resistance in adults with prediabetes, challenging long-held assumptions about red meat and metabolic risk.
Conclusion and call to action.
That wraps up your comprehensive medical briefing for today. From the rewiring of our brains via GLP-1s to structural new AI models fighting superbugs, healthcare is moving faster than ever. Which of these breakthroughs do you think will have the biggest impact on everyday life? Let me know your thoughts in the comments down below. Drop a like if you found this video valuable, share it with a friend, and don't forget to subscribe for your regular dose of verified medical news. Stay healthy, and I will see you in the next video. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience/viewers must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.